Watchers of the health sector say Nigeria produces a large number of medical personnel annually, but the big challenge is that they leave the shores of the nation too soon for greener pastures. This problem of brain drain, which the nation is battling so hard to tackle, was the focus of the annual general meeting of resident doctors of the Federal Neuro-Psychiatric Hospital in Yaba, Lagos. Senior correspondent Jacqueline Ogo reports.
In Nigeria's medical sector, there is a continuing exodus of medical personnel who would have added world-class value to the country's development. But they continue to leave because the gap between the benefits of their counterparts in the developed world and theirs have a depressing effect on them. The ceaseless exodus, now known as the Yaba syndrome, was the focus of the annual general meeting of the Association of Resident Doctors of the Federal Neuro-Psychiatric Hospital in Yaba, Lagos. Dr. Olusegun Olaopa is a high-flying consultant surgeon who has done over 100 surgeries. He is not happy with the current situation.
I've had experience where I've had to work on a patient that was a victim of road traffic accident, and there was no tools, nothing to use. Even sutures were not available, and we had to use our bare hands to do some of these things, and it puts us in serious risk.
A doctor and a former university professor who once worked in the United States for several years was the guest speaker. He says the problem of Nigeria's health sector must be realistically addressed.
A catastrophe about to happen if something is not done. Our healthcare system is fast collapsing because all our doctors have gone.
In medical terms, the care of the elderly is known as geriatric care. Experts say this care is being abandoned by youths seeking greener pastures.
All of a sudden, our towns are getting empty. Our youths are gone. The elders are left uncatered for.
And in some cases, the mother will also be taken to come and look after their children over there. And the man will go into depression as a result of this. And this will create a heavy burden on the mental health system.
But this HR practitioner is making an appeal.
Irrespective of where they go to, they should still have their heart and their focus at home, knowing that they can still contribute immensely to the development journey of the nation.
Watchers of the nation's health sector say what will be big news will be when the government begins to address more deliberately and effectively issues making the nation's health workers flee the country without looking back. Jacqueline Ogo, TVC News, Lagos.